on this panel section will be Dr. Ilori Adeniji. He'll be taking us on the prostate cancer, hepatitis B, and general health talk. Let's clap for Dr. Ilori. We have 5 men, right? So the next I'm going to call in is also important, business. So let's call on Mr. Ikechukwu Ilemadi. He'll be taking us on business and investments. All right, so we have 6 great men, 6 great topics, 6 great field, and 6 great aspects of life, right? So we're dishing out great words. Please get your notepad, get your pen. I'm begging you because knowledge is key, okay? To anchor this session, we're going to be calling a very great man. He knows how to bring the answers right from their lips. And he knows how to put them on the spot. And he also knows how to pause them when they are going very far. So let's clap for the moderator of today's panel section. No other but Mr. Adewale Adeshete. Let's clap for him. All right. Okay, so I'm about to sign out, so you guys should take care of yourself. And remember, as a man, you should what? Believe in what? What of the affirmation? Believe in what? Your strengths and your weaknesses. Thank you. My name remains Samuel Elvis. So we see you again in the next Men's Week. That's 2025. God willing. I love you all. And don't come to the speaker and say man up. Okay, express yourself. So I'll leave in great hands. God bless you.
All right. Thank you very much, Samuel. Thank you, everyone. Thank you for giving me this privilege to anchor this session. Okay. So we'll quickly move to this program. I'm sure some of us have been waiting. You've seen some of the pictures and the topic he has talked about, what they will be discussing, or what we'll be doing this evening. So this is going to be an interactive session. So first of all, we'd like the panelists to introduce themselves properly, what you do, and how many years have you practiced, or what you are doing currently. And this should take us like 1 minute each. So I'll start on my left-hand side here with the doctor. Thank you.
All right. Good evening, everybody. I'm Dr. Olumide Adegu. I'm a consultant psychiatrist. I work with Ali Mosho General Hospital, Igondo, Lagos. And I've been practicing for 25 years now.
Use the mic.
Wow. Wow. Thank you very much, doctor. 25 years is not a child's play. I think it deserves another round of applause. Fortunately, I live very close to your hospital, so I'm sure we are neighbors. All right, so I think I'll move to the next, our barrister in the house. Thank you.
Yes, my name is Moses Enema. I'm a legal practitioner called to the Nigerian bar, and I've been in practice for 15 years. I was called to the bar 15 years ago. And I do both civil, criminal, and corporate practice.
Thank you very much, barrister. Okay.
All right. My name is Ike Lemadim. I'm a custom marketeer, so I'm pretty much into brand building, custom marketing. 10 years experience. I actually started from sales, then moved into custom marketing, and I've been there since. Work with Guinness Nigeria. We are, of course, practice custom marketing. So that's just brief about me.
Wow, thank you very much for writing. It's not, if you see the set of people we have here, it's like a balanced discussion. I'm sure you know that. Okay, so let's move to our next panelist.
Thank you very much. Peter is my name. I'm a life assurance practitioner. I've been practicing for 5 years now. And what I do majorly in this sector, I focus on financial advice. So I'm a financial advisor in this sector. Thank you.
Wow. Thank you very much. Okay, so I'm sure your team members are here this evening.
Yeah.
Okay, so he's still going to tell us much about what they do at this place, which can be of benefit to us. We are not just bringing them to come and talk to us, but at the same time, let's see the practicality of what we can do after the teaching and the learnings, and bringing it to reality. Thank you very much for coming with your team all the way from Leadway.
You're very welcome.
All right, so we move to Doctor.
Good evening, everyone. My name is Dr. Ilori Adeniji. I've been practicing for about 10 years now. And I'm a resident doctor at LUT Ideraba. That's Mushin, that's Federal Teaching Hospital, Lagos University Teaching Hospital Ideraba.
Thank you very much, Doctor. Thank you. We want to welcome you once again. All right, so we'll move to our own, permit me to call him this name, our own Odogu.
Praise the Lord. All right, my name is Paul Briggs. I'm a clergy and also a certified relationship and marriage coach, and a certified counselor too as well. Amen.
Wow, certified. I think you deserve another round of applause. Please, let's jam our hands together for all our panelists. Okay, so thank you once again for making your time out. I know it's not easy on a Saturday like this when everyone is preparing for their, for the Sunday service. Thank you for coming out to celebrate the Men of King's Dome. This is our week. We do it on a yearly basis. So we'll move straight into the questions, and at the same time, we would like to, bring some of the samples you want to share with us, some reality and what can be done. So we're going straight into the questions right now. I would like to start with Dr. Olumide. If you look at all the topics we are discussing this evening, like I mentioned, we're talking about well-being of men. When we talk about well-being is not about just the medical alone. It goes into your financial, it goes into your physical, it goes into even your medical, outfit you have. And you can imagine us bringing us a barrister because a lot is happening out there. To be honest, I will share my own experience with you when it comes to some of the things we'll be talking about, because I've been practicing for over 17, 18 years as an HR professional. I have seen a whole lot happening in this field. And that's why we brought them here, to make it a balanced discussion. When we have people that will advise you on how to plan your investment, we have also a barrister and 2 doctors, not just anyhow doctor. You can imagine us bringing on board a special psychiatric doctor who is also an expert. A lot is happening to men, a whole lot. I'm happy we are all men. We can discuss at length. All right, so I'll start with Dr. Olumide. So the first question is, how do societal stigma, I'm sure we all know what stigma is. Stigma can come in any front. I remember when COVID happened in 2020, how some family, whenever you see the men coming with their white, I don't know how to describe it, they come with their white coat to come and pick, some of the patients. People will stand at their window and say, oh, they have COVID. After that period, we see them coming back from the center, and a lot of people say, oh, he's a COVID patient. Oh, Emma Sumo, don't go near him. These are stigmas, a whole lot. A lot of people having a lot of medical issues that they are battling with that are known to society and some people around them. So the question is, how does societal stigma impact individuals seeking mental health treatment? And what are the effective strategies to combat this stigma? Thank you.
Thank you very much. The issue of stigma and discrimination is not only, like he said, it's not only about mental health issues. It covers other, maybe physical health conditions like the COVID he mentioned, proper leprosy, tuberculosis, and a number of them. Now, is it that stigma? I can say, or I can tell you authoritatively, is a negative mindset, and it seems to be commoner in we Africans or black people. The issue of stigma is not as common maybe among the whites, and it has enhanced their own, let's say, availability, their own opportunity for patients to seek care. But stigma in Africa has really, really hindered our people
from seeking health care. You know, people don't want, because of that stigmatization, it's a negative label. Sometimes they call it a kind of stereotype. Probably because we are Africans, it's like a blemish, it's like a label. Because of that body, that stigma is really, really burdensome. That burden on the patient or the client, so to speak, it drags them. You know, it doesn't allow them to come forward to be able to identify or take ownership of their condition, to come to the hospital or to seek for counsel or to go to anywhere to say that, please, oh, I need treatment for this, I have this condition. So that stigma is a big issue that has reduced our people, Nigerians, Lagosians, from coming to the hospital, from stepping out confidently to declare or to seek treatment from experts that I have this condition, I have this mental health condition, I have this physical condition, please, I need treatment. So it's something we work on. How do we reduce stigma? How do we reduce discrimination? How do we reduce stereotypes among our people so that it can enable enable sufferers to be able to seek treatment or to seek care? One of those things that people do, and you must have experienced it, that probably when we want to do mental health day, we will go and hire maybe celebrities. We will do t-shirts. We will walk across Lagos just to seek identification, just to bring down that weight, that as if to let you know it is not a myth. And we use that opportunity to educate people that these things are very treatable. These things are normal. These things happen to all of us. These things happen to our friends. These things happen to our colleagues. These things happen to our family members. Let us all take ownership of this condition, no matter how shameful it thinks. In fact, it is that awareness and sensitization that brings down the shame and brings down the body, and that lightens the heart of the sufferers to seek mental health care, or as the case may be. It was the second leg of the question. Okay, part of the effective strategy is probably what we are doing now. Because in those days, people used to look at psychiatrists as they themselves, they have a mental problem. As a matter of fact, I have a friend that tells me repeatedly that psychiatrists are first of all patients themselves because they specialize. You know, they said that's why I'm able to do it well, because I understand what it takes. You know, that's just on a lighter note. But as I'm coming, at least you know that psychiatrists can dress well. Psychiatrists are accessible. Psychiatrists are normal people, just like everybody. And the same way we come out every opportunity we have on the radio, on the TV, in fora like this, to discuss mental health conditions and educate people. We create awareness, we sensitize people that mental health conditions, no matter which one it is treatable, is manageable, and the sufferers can actually live quality life. So far, they adhere to the instructions we experts give to them. Thank you very much.
Wow, thank you very much, Doctor. To be honest, you have said a whole lot within these 2 minutes, and it has covered a whole lot. I'm sure you see a lot of awareness being done on the streets of Lagos, World Cancer Day, World Hepatitis B Day, World Hypertension Day. These are part of the way to manage some of this. A lot of men, like you mentioned, suffer some of these medical disorder. A lot of us have 1 or 2 issues, but we are scared, like you said. And one of the things they've done is to ensure that they create more awareness. You see a lot of people during the Cancer Work Day, a lot of people coming to associate themselves because things are happening. We need to break that bond. And that is why, as men, we need to learn to come out of this shame. Doctor is there. We have 2 medical practitioners here. Please, in case you have anything you want to talk to them, I'm sure you know that when you talk to medical people, it's highly confidential. They are like lawyers. They are like pastors. So please confide in them. Don't be ashamed. And that's why we are having this session, whereby we can have the courage to ensure that we, talk to them, open up to them. If you notice anything, I was with someone this week in Lagoon Hospital, and the person said, I'm sorry, I cannot do this because I work in this hospital. I don't want anybody to know I have this condition. These are part of the issues. And here, the hospital, the person will get it free because he's a staff of the hospital. But because he's scared of the stigma, and now he cannot afford to do it outside because of the cost. So these are the things. So Dr. Lumide, thank you for sharing this. But apart from what your organization in terms of government and what some of the agencies or bodies are doing, individual, what can they do to ensure that they overcome this fear of being stigmatized?
Thank you for that question. I think what individuals can do is to speak up. You know that people generally say that maybe a word or when you share something, problem shared, they say is half solved. You need to speak up. That is number one. Then speak up to the right person. People speak up, they talk to wrong person sometimes. But speak up and talk to the right people. I can tell you authoritatively that no matter what you are passing through, maybe any mental health condition, you are not alone. You think you are alone. You are not alone at all. So be courageous and speak up. And when you are speaking up, make sure you are talking to the right person. And how do you get the right persons? You come to the hospital. There are healthcare workers around you. Even before you come to the hospitals, maybe in programs like this, the social group or organizations we belong to, there may be doctors there, there may be nurses there, there may be counselors there, there may be psychologists there. You speak up to somebody. You speak up to your pastor. Unfortunately, the pastor knows everybody. You and I don't know everybody in the church, but pastor has the privilege of knowing who is who in the church. So if you speak up, you will be well guided. So speak up to the right people, and I'm sure the care you are looking for, you are going to get it.
Praise God. Let me try and say it. Your field is very loaded because particularly even in the concept of the marriage and relationship field. I remember counseling a man a particular day that came, and he was talking about how his wife had left. Brilliant woman had left and gone to one place, isolated area. And the man kept talking, and as he kept talking, I said, Oga, and he came because he was coming to say he's going to divorce the woman. And I said, Oga, this woman has gone to, when he said one or two things, I now found, a T-junction. Your wife has a mental case, and you want to divorce. Will you go and take your father and go and grab her? Because they go to an isolated place, somewhere in Ogun State, and they are just there. They believe that Christ will come very soon, and they all live like primitive individuals. I mean, like, this is a mental case. Go and grab your wife and take her to somewhere that actually. Now, I want to ask a question now. How does a mental situation start? And how does it, how do we now define that this person has a mental problem? Where is there something that leads to it? Is it hereditary one? Is there something that leads to that too? Sir?
That's a very popular question. But let me start with this a little joke about it, just to explain something. It happened in a celestial circle. And the things that happen in the celestial environment. Visions, all those spiritual stuff. So that had been happening there. So there's this particular lady. He was seeing visions. She was doing prophecy. She was into trance and all that. That ordinary people would think, it's part of the spiritual performances. But it is the prophets themselves that brought her to the psychiatric hospital that this one is different from the one we used to know. that this one has gone, beyond. So, those are the issues. So to now come to the question, sir, you see, the causes, in fact, we don't say that the cause of mental health condition is hay. We don't talk like that. We say that the mental health or psychiatric disorders has that is the causes, as a biopsychosocial model. That's the way we say it, because there is no particular thing that you say causes it, but it has a biological causative factors. We have the psychological causative factors. We have the social causative factors. Now, either the two or the three factors interact together to determine when it will happen and how, or the cause that illness will take. However, researches have shown, and I have personally seen it, is documented in our books, that 80% of, let's say, mental health issues are genetic in origin. And this is the way you can understand it. I said genetic in origin. That is to say, there are genes. I'm sure from our biology, you remember what genes are. Take, for example, there is a gene that dictates or that is responsible for everything about us. There is a gene responsible for my height, of course, inherited from my parents. There is a gene responsible for how I talk, how the pastor talks, my complexion, his complexion, and of course, inherited from the family line. Okay? There is a gene that is responsible for high blood pressure, diabetes, cancer, and many, many other even physical health conditions. And those genes are heritable. They are passed down from the family line. The same thing for mental health conditions. There are genes responsible for it. And those genes are many. In fact, let me give you the name of one. It is coded as COMT, C-O-M-T. I can't remember the full name. That is the name of one of those genes responsible for mental health conditions. There are others. There are many. Now, it is said that those genes responsible, they are randomly distributed in the population. That is to say that probably all of us, or a good number of us, may have one or two or three of those genes in our system, so that the person that will come down with any mental health condition must have had enough load of all those genes to make him vulnerable to any of the mental health conditions. So the more of the load of the genes somebody has, the more the vulnerability. And it is already documented that 80% of all the mental health condition is largely dependent on that vulnerability of the genetic composition. So if somebody is vulnerable, now suffers a divorce, that is a stressful factor.
Like a trigger.
It is enough to trigger a breakdown. Then probably, even if it is not, okay, let's say, apart from the psychological stressor, that is the divorce, now becomes homeless, or lost her job. Those are social stressors. Now look at those psychosocial stressors. They are severe. Some psychosocial stressors are like bereavement.
Okay.
So those things can work together with that large vulnerability to determine, oh, this person will calm down. Compared to somebody that has the same vulnerability, but lives in Banana Island all through his life, never suffered any divorce, had a very good relationship. Even though he's vulnerable, has the same load of genes in his system. But because there are no psychosocial stressors in his life, that illness may never be triggered in him, and probably it could be any of his descendants that had any psychosocial stressor. I think that was...
Honestly, I think, let's give it a real good round of applause. You know, he was able to break it down to the extent that if you bring in a 10-year-old boy, you will understand what he has said. I believe we all understood what he did. Very clear. Please, if you notice any of these things he has said, please, not everybody that goes to psychiatric hospital that is mad, to be honest. So don't assume that any people that go there, they will say, oh, Yaba left. Don't think they're mad. A lot of people go for a lot of disorder issue. Please, let's open up. Let's pick up. I think it begins with us. Thank you very much, Doctor. All right, so in the spirit of this topic, I have one for Pastor Paul. Okay, so the question is, how can we address and overcome feelings of inadequacy, insecurity, and comparison in relationship and marriage?
How do we feel? How do we come again?
How do we address and overcome feelings of inadequacy, insecurity, and comparison? Like when you compare in relationship and marriage.
First of all, you have to actually, come to a place where you know who you are. There's something that is called, self-awareness. And a lot of times people haven't actually come to that place in themselves. And then they usually want somebody to actually complete them. Nobody can complete you. You're already complete in him. But you must get to that place of self-awareness first for you. Believing in yourself, having a strong 10 on you. When I mean a strong 10, means that you actually know you, how you were made, who you are. Because if you don't know that about you, when you get into any relationship or a marriage, what happens is that they will now become competition, or you're trying to compete with somebody, you are trying to be what you are not. So you must find you, discover you, and once you have done that, and then you know who God has made you to become, you found yourself in God first. Then you can have a balanced relationship with someone. The first person that Adam first saw was who? Was first God. He didn't see the wife. He didn't see a woman. It was first God. And then God showed him. And that was the first thing he had to deal with first, himself. And then after that, then God said, it is not good that man should be alone. And then brought someone. First brought fishes and animals and said, these ones are not suitable for him. And then it wasn't even Adam that wanted a woman. Adam didn't even know he needed anybody. Adam was busy doing something. He was busy discovering, busy looking at what God had done. So there is a place for the individual, the man, to find himself. That's why a lot of times when you ask a man, who are you? They tell you what they do. Because man is defined by work. Really, you are not your work, really, in that sense. You need to find who you really are. Who are you? And that is the person you must discover. And once you find that person and discover that individual, then you are set, ready to actually go, because you already know who you are. And any relationship you enter into or marriage you get involved in, it becomes easy. You are rest in who you are. You have self-love for yourself. Self-love. You know yourself. And that helps you, to actually enjoy a relationship or marriage.
Wow, thank you very much. That's very prompt. There's something we call, for those that are HR practitioners here, I have a brother here, there's something we call know yourself in developing your competency. Developing your competency, you must first of all assess yourself, know what you are, understand your personality, what you can do, and looking for a way to support those areas that you're not doing well. And thank you very much for saying this, that know who you are first. All right, so quickly I will move to Dr. Hillary. At this point, are there any specific gender health issue that men should be aware of? You know, I'm sure you know some of these things that men go through recently. Just share a few with us, some of this that we need to be aware of, and what can we do to prevent some of them?
Okay, sir. Thank you for that question. So let's go straight to the point. Some of the gender health issues that men should be aware of are the issue of the prostate enlargement. So because most men were not aware of this, and they will be having that issue in Lutz Day. On daily basis, we see patients, although in their 50, 55, 60, 65 years, they will be coming down with urinary incontinence. That's urinary retention. They are not able to urinate very well. Some other things will crop up like that. So prostate is a gland at the base of the bladder and is around a pipe we call urethra. Is the pipe that passes through the penis. So that pipe is the one that brings out the urine outside. So, but prostate gland now wrap around it, and that gland has been there since the day we are born. And gradually, as we get older, the gland too will also increase in size. So, but it will now get to a certain level around that 50, 55, 60 years, whereby the gland, after increasing in size, will now start blocking. Like when you try to squeeze the urethra, that's the pipe. When you squeeze it very well, nothing will pass through. Then you start having inability to pass out urine very well. Probably you are not. Some people wake up 4 times, 5 times in the night to go and urinate. After, even when they get to that place to urinate, it will be dripping, little by little, little by little. So those are the symptoms that you'll be seeing. And at times, it will be incomplete voiding. So at times, there will be pain while urinating. At times, it will come with blood. So those are the things that you look out for. So, and all these things will start from enlargement of the prostate. Although there has been so many research, no particular specific point to say that this is what caused the enlargement. Exactly. But there has been implication of hormone like testosterone implicated that for the enlargement. And the enlarged prostate comes mostly in the black race. And if you also have a history, maybe your family, maybe the father or the uncle has history of prostate enlargement before, so you should also watch out for it. So those are the things that could be a risk factor for it. Right. And it occurs within that age range of 50, 60, 70 years.
Okay, thank you. Okay, Doctor.
Just a little addition. I used to explain, that question this way: that so long we are human beings, and you carry flesh and blood, and you are exposed to the elements, to the weather, we are prone to sicknesses and diseases. Don't forget that. In the atmosphere, there are bacteria, there are viruses, there are all manner. And I'm sure if you remember agricultural science in those days, you remember weathering. That weather alone can melt a rock. That's the same weather you and I are exposed to on a daily basis. So when you are exposed to that weather and elements over time, it begins to tell on our bodies. And the longer you spend under the weather, that is to say, the older we are, the more prone to those physical health conditions, the more prone we are. So, prostate matter, high blood pressure, diabetes, ulcer, all manner of things. The older we are, the more pro we are,
the more exposed we are. Thank you very much. You know, the more we grow, the more we get to exposed to this. I think one of the things we can do more is to ensure that we have our comprehensive medical screening. Am I speaking in the mind of some of the men here? Doctor, am I correct?
Yes. Likewise for the BP, that's the high blood pressure. You need to check it regularly because this evening I saw one of the results, 194/105. That's the very high. That's going to hypertensive emergency, and that's very high. So like this, small, you won't know. You think it's malaria, and you use Amatem, use Lumatem, and the rest. So and you still complain that something didn't go because you are not attacking the source, the resource. So BP, you need to check it every day. And we need to also check our the way we consume sugar too. That's
all right.
Our blood sugar level. You need to do it too regularly.
Thank you very much. These are valid. Okay, you want to contribute?
To ask a question.
You want to ask a question? Okay.
Yeah, my question is, I need a clarity on this prostate cancer. Because I had a conversation with a friend some time ago. See, he said something, and I'm still doubtful of it. So I think I'm in the right place to clear my doubt. So he said there is a link between sexual intercourse and prostate cancer development. So is there any...
You know what? You just took the questions off me. I was about to ask doctor. You know, recently, some months ago, we saw a video trending of a doctor saying that you must have sex at least 28 times in a month. Is it 20? And I asked myself, is it government work? You know? So I think it's good we are in this spot. Thank you for asking this question. Honestly, I was about to ask the two doctors in the house.
Okay, thank you, sir. So when you have those symptoms that I mentioned the other time, then you should go and see your doctor. And your doctor will now recommend you to do a test called PSA. That's prostate specific antigen test. So it has a range. So with that range, they'll be able to determine if you're having enlargement, this and that. But know that if you don't treat it on time, the enlargement can also transform into what we call cancer. Cancer will not start immediately. It's enlargement. So when you treat the enlargement, everything will shrink and you'll be able to, and some other treatment. So now going to the question that you asked. From the research, although there are two schools of thought, some will say, no, there is nothing like that. But some other people also agree that, okay, the more you ejaculate, about 2 or 3 research I saw, that they did a particular research and they gathered some men. And they now watch them over 10 years period, whereby some of them that ejaculate like 21 times in a month were able to prevent having prostate enlargement. And those that ejaculate like, let's say, 4 times or 7 times in a month were prone to having prostate enlargement. So those are the results of their test analysis.
Okay.
That's to prevent, not that you are actually have the enlargement. Because if you have the enlargement, the cells will not help again. But that and it now depends, because in that research also, they discovered that those who have more of sex, maybe during the 20s, 30s, probably during their 40, 50, or 60, they now relax a bit, are now prone to having prostate enlargement. So it now depends on when you have more of the ejaculation. Ejaculation may not necessarily mean that you're having sex every 21 times in a month. So ejaculation can come through other means. But ejaculating 21 times in a month, according to some of the research, says that those people actually were able to prevent having prostate enlargement.
So which is valid?
Well, I will also support it. I will support it because having the ejaculation regularly in the month will strengthen you having more of testosterone release, because that's one of the hormones that is implicated in this issue. And because as we grow older, the testosterone reduces and the estrogen doesn't increase. But when we have more of the testosterone, then there's tendency for that person not to have, to prevent, not that it has, because if you already have the enlargement, you just have to use your drug and some other treatment. But to prevent it, right, then you can have more of the ejaculation, okay, according to research.
Okay, so let's add the second validation now.
Thank you very much. Just one or two lines. Probably because I'm not into maybe areas, like that. I'm into mental health. I've not seen any research proving that narrative. I also saw the narrative, and people are saying it, but in the medical world, though, I've not seen any research like that.
Okay, sir. That's why I said that it's too thoughts.
But you see, the document that I read that is like for that school of thought that it cannot ejaculating 21 times a month can predispose people to cancer of the prostate. This is the explanation that when the prostatic fluid, like he said, is a gland. Now the prostatic fluid can gather inside the prostatic gland, and if it is not emptied, it can be infected. Okay. So don't forget that there is bacteria inside the body that flows inside the blood all around. There are bacteria like that. So if that prostatic fluid, prostatic fluid is supposed to mix with other fluid to form the semen that comes out during ejaculation. So if the prostatic fluid is not emptied, it will gather. Sorry, I'm going to use the Yoruba word here. Omarogun. It will gather and there will be stasis. So when that happens, it will be infected and cause prostatitis. So the infection is going to be a kind of enlargement of the inside of the prostate gland. Wow. So when you are now exposed to that prostatitis, you are not emptying that fluid regularly. It can now predispose, because it's going to be acting negatively on the prostate gland and can predispose that person to cancer of the prostate. That's the explanation, but I've not seen a scientific evidence of that claim.
Okay. Praise God.
Hallelujah.
Now that doesn't mean that you should go and be masturbating.
I was about to go there, Pastor.
Because that is exactly what is playing in the minds of people. That if that is the case, I'll not be masturbating anyhow. That means that get married.
Exactly.
Get married, and if you've been prolonging your getting married because of no money, that's a lie. I didn't marry with money in my account. Because a lot of times we men say, I'm not ready. When will you be ready? You might never be ready. Calm down.
Okay.
Now, you can see. The thing is to get married. In that way, when you are married, you can now begin to sleep with your wife often. Not 21 times. If not, you don't have work.
Okay. When you are married, you can have sex anytime. Any day. You can have it 4 times in a day, 7 times in a day.
Yes.
Because let me tell you the dangers of masturbation. Because a lot of times people don't know that there are certain dangers to it. It might not be dangerous health-wise, yes. But you see, the dangers about it is that when you start to masturbate and you are married, the truth about it is that after a while, your wife will satisfy you again. You always have to go back to that thing. You will always, because something is now aiding you. So you will no longer see the need for having that wife. That is distorting the concept of marriage in itself. And then you can become an addict. And once you're an addict, then chronic masturbators have issues. There are now some medical issues that come with chronic masturbators. Praise God.
Wow, thank you very much, Pastor. Thank you, Dr. Olumide and Dr. Ilori. You validated some of these things to a point, and like Pastor has cleared it, I was almost saying it that hope this will not lead to a lot of abusing sex and you know what we do now sometimes. So he has advised us, for those that are not married, please ensure that you get married on time. We are not chasing you out of the single world, but at the same time, you need to prevent some of these medical issues. And these are the ways you can, God that created man and woman knows why he did that, is to aid and support us. So just to ask Pastor, I was about to ask a question in this area. No, I'm coming to money and we. Okay, I'll come back to Pastor. So let me go quickly. So let's take this medical issue. I know a lot of people are worried now. Let's douse it down. Don't be scared. Don't be scared. Promise, I can see you looking worried. Okay, so I'll go to Barrister Moses. I'm sure you must have been hearing about will. We'll be hearing about trust and will. As a lawyer in the house, can you tell us the key difference between a will and a trust? And when should each be used in estate planning? And another question I would like to ask, is there any age limit when someone can have either of the two? Thank you.
Okay, to bring it very low, when we talk about will is a situation where an adult, because the will act, which many states has domesticated into their law. Like under Lagos State, we have the wills law of Lagos State, does not specify the age of an adult. Some states 21, while some states 18 years. But it is a situation whereby an adult formally writes how he or she would want his estate to be shared after his death. And in law, the person that makes a will is called the testator. The testator is someone that makes the will of how he would want his estate to be shared. So when we talk about estate, you could talk about valuables, your houses, your shares, stocks, and all that. And we also have beneficiaries of will. For one to, it's important I also mention how a will can be valid. So for you to make a will, it must be made in the presence of two witnesses. And when you talk about two witnesses, it's not that you write a will, then you instruct someone to take the will to a witness's house to sign. After signing, you take it to another witness. No, it must be done in the presence of the person making the will. And the two witnesses must be adults, and it must be such that these witnesses cannot be beneficiaries of the will. Then another thing is the signing of the will by the testator. One thing that should be considered is if the testator must be a person of sound mind, in the sense that at the time that you are making the will, that you are giving instruction, the will has been written and all that, you are saying your consent was not obtained wrongfully, which is very, very key. Another thing is that, yes, the person must be adult, and if the person has any ailment, particularly if the person is blind, there are special documents that is also required that must be prepared alongside. A blind person cannot sign, so it's best for it to be thumb printed. The essence of all this is situation whereby the testator dies, for such will not to be a subject of litigation. Because if, for instance, one of the children is not a beneficiary to the will, that's one of the things that will be raised. But if all these elements are met up with, so to say, it clears it. So if you are now talking about the issue of trust. Yes. What you should consider is the beneficiaries of the will. What are their age ranges? Do we have adults? If you are talking of someone of probably 7 years, a boy that is of 7 years old, you cannot give a house to a boy of 7 years old that this is the property that has been betrothed to you without clearly stating how it will be managed until when that child becomes of age. So one thing we usually ask as a lawyer that does will is that there must be clarity in you making a will. Brevity is very, very important. Clarity is very, very important. Okay, I was able to interpret a will of a popular allergy here in Lagos, Ajao, the late Ajao, and this Baba had over